I'm thrilled to have you here today. It is for Breast Cancer Awareness Month. And this is near and dear to my heart because you all know I've been through this. And I have such a treat. I have little butterflies dancing in my tummy. I have Dr. Elizabeth O'Leary with me. She was my surgeon. She's amazing. You're going to hear about her. She studied at the U of M. She worked at Johns Hopkins before she started her own private breast center called Lady Slipper. She's got 3 locations in Minnesota. So we'll have a connecting email address and website in my show notes. But she's so amazing. And we are talking all things breast cancer today. And this is what I always want you to know. I am cured and they are curing this all the time. They have made leaps and bounds, and we know the most important thing is early detection. So get that mammogram. Let this be your reminder if this is all you hear. I want you to know that I'm really excited because we're going to get to know Dr. Elizabeth a little bit more. We're going to talk about my cancer journey. We're going to talk about some of the advances in treatment. And we're going to talk about ways to detect breast cancer. And, I just know with her, there's a lot that I'm going to learn that I didn't know before. So, and then on Thursday, I will wrap it up with more information that maybe we didn't hit on. So I'll talk about that in Thursday's Saddle Up segment. So thanks so much for being here. You're going to love this angel of a surgeon. Listeners, I have like happy butterflies in my stomach. I'm so excited. I know, and you're like, excited about breast cancer? No, I'm excited to talk about it, to get the word out. And I have such a special guest with me today. I'm probably going to get teary through this. I have Dr. Elizabeth O'Leary. She was my breast cancer surgeon, and my husband calls you the angel. And we'll get more into, how you kind of helped me through my journey. But what I am so excited about today, Dr. O'Leary, is this is such a great opportunity. I get to know you a little bit better and I have goosebumps because you were such an amazing physician to me. You were part of changing my life, which is such a blessing. You know how blessings come out of these hard things we go through. So I'm so excited to learn what led you to do this work.
Thank you so much, and thank you for your kind words. It was actually my honor to take care of you. So I'm very, very happy to be here. So happy to be able to share my story, and of course my hopes in all of this is that it's going to inspire somebody to go out and get a mammogram and just do it just to and potentially find an early breast cancer. Yep, hi, I'm Dr. Elizabeth O'Leary, and yeah, so I have kind of a circuitous story, but I have had a lot of cancer in my life and my family, including breast cancer. And so really cancer has always been something that has been incredibly important from a child onwards because of my so many family members who have suffered from different cancers, all sorts of different cancers. Um, and I essentially, at one point in my life, went off to school on the East Coast to Johns Hopkins. And my mother said to me on my way out, "Don't go to school outside of the state. You're going to meet somebody, fall in love, and you're never." And as mothers tend to be right, she was right, and I did. I met somebody, fell in love, and had my wonderful husband. And we actually did. We ended up staying for many years out on the East Coast in the Washington, D.C. area. But the big blessing from that was that I ended up being able to have the pleasure and the honor to work at a wonderful private breast center in the Washington, D.C. area. And it was just a phenomenal setup. We were able to really take time with patients and spend as much time as they needed. Every single breast cancer patient has their own story. They have their own disease because no two breast cancers are the same and no two people are the same. So being able to spend that extra time really makes a big difference. It helps the patient to understand their disease. It helps us to understand like how is the best way to help this patient. And then, there was this element too of, we don't want to just, operate and disappear. We want to be there before, during, and after. We want to help them to not only get through all this and get cured, but we want them to do it, powerfully. We want them to have a great quality of life. We want them to really thrive, not just survive, right? And so we really embrace the whole survivorship journey as well. So this was just such a phenomenal place that I was working at.
Mm.
So even though I told my husband when we got married that we were going to move back to Minnesota because I am a Minnesotan through and through. I love Minnesota. I love Minnesotans. I love our culture. But it was just such a great work environment. And I miss everybody back there. It was incredibly difficult to leave. I miss my wonderful partners and my patients. So they got to take care of generations of patients with breast cancer. So they became part of my family too. So it was a really, really special place. And finally, COVID hit. And actually, it was kind of a good big kick that I needed to say, oh, we have kids and we have no family. Really, we really need to get back home. So we came back to the Twin Cities and, really I looked around because I wanted to find something as special as what I had out in the East Coast, and there really wasn't. We had lots of big corporations, and my heart and my training and my experience was all about trying to have something where we could just not trying to get as many patients through as fast as possible, but really trying to connect with patients, help them on their journey, and really have that personalized approach. So that is what inspired me to start the Lady Slipper Breast Center here. I really wanted to have a place that patients could go to get that personalized, comprehensive care, to be able to have time with their providers and have people who really cared about them. And we're not beholden to a system. So I get to send people to the best place, the best medical oncologist, the best radiation oncologist, not somebody who I'm happen to be in the system with. So many elements to all of that. And then of course the also other thing that people always ask about is about the Lady Slipper breast, the name.
Yes.
In the world did we come up with this name? Well, well, I wanted something that was purely Minnesotan, and I thought, what more Minnesotan than that beautiful Lady Slipper orchid, which is our state flower. And so, I thought it just embodied our Minnesotans, and I thought that would kind of be all inclusive. And actually, it was really neat because after I had opened, I had a patient, Native American patient, who came through, and she had chosen Lady Slipper because of its name, because it turns out there's a story of a brave little girl from an Ojibwe tribe. And the legend is about this little girl. She was seeking medicine for her family and tribe in the cold winter. And in her journey, she does end up retrieving the medicine from another area far away. Um, but she encounters, of course, our wonderful Minnesotan harsh winter snows and loses her moccasins. So her feet ended up bleeding in the snow. And as she finally came back to the village and saved everybody, but when the snow melted, they looked for her moccasins, but instead in those bloody footprints, they found the lady slippers.
Aw.
So that's their story and their interpretation of the lady slipper. And I think it's wonderful and really allegorical to the story of our breast cancer
Wow.
patients. I mean, I think they
Yeah.
travel a very difficult road to seek out medicine and a cure for their cancer. And then they succeed despite
Yeah.
that difficult journey, and their bravery and
Yeah.
courage leaves beautiful flowers of hope growing in their path. So I think it's just such a beautiful name for that reason. I thought
Yeah.
it was really kind of brought together the whole idea.
That's beautiful, and I am tearing up as I listen to you, Dr. O'Leary, because I can't help it make it personal. You did I'm so thankful that you came back to Minnesota because, I would not be the same if it would not have been for you, and I mean that and that is from there's so many different things that you helped me with. But I think and I told Dr. O'Leary that I would, tell my story because my listeners know I've been through this. And when I first contacted you, you didn't even work with my insurance, and you were just so sweet, and you said, "Just come in and we'll talk through it." Now, this is what was so weird about me. I was always someone really into health stuff because I was so terrified of ever getting sick, and I would, like, research everything and wanna know everything, and then this hit me, and I was like, "Bleh," and I think I came in, and I think I started out not being that nice to you. I think I was like, "Well, I can't work with you anyway," and you were so sweet, and I remember you just said, "Let's just sit down," and you taught me. And listeners, you sat with me for over 2 hours when your clinic had closed, and you sat with my husband and I, and you went through absolutely everything. So I would know what the possibilities were, but this was the thing that was so amazing was it didn't have to be so scary. You were like 98% positive outcomes. Like, even, yep, it's gonna be hard, like this type, you have to have chemo. And that's gonna be hard, but you're still gonna have a great outcome. And so that's what I held on to. And I didn't have, like, I wouldn't have had that belief except for you. And then you connected me to a beautiful oncologist who was amazing, and you set that up. You helped me go to the places that would work the way you knew would be best for me, that would be gentle. I was a wreck. I mean, I had so much anxiety over health, and interestingly enough, that's healed. I mean, it's truly a gift from God. It's been such a journey, but sitting down with you that day was a game changer in my journey. I still didn't wanna do it. I still was scared, but let's talk about that, and I'll throw some other things in as we go to about my story and the things. I mean, I sent a friend to you who needed you shortly after me, and Dr. O'Leary, I remember I told you a story about a friend who said she wouldn't have done the double mastectomy again because she said, "Every day I look," and I told you that, and you said I listened to what you said, and you just did the lumpectomy, and then I remember I went to the bra store and they said, "Are you gonna keep your nipple?" And I was like, "What?" They started bawling. I'm like, "Well, I don't know." So then I brought to you, and these things that you don't think would bother you, poor women, it's like a piece of you, my heart goes out. And so we didn't know. We didn't know if you were going to have to, but you were so careful, and you checked the margins, and you did such an amazing job. And it's honest to God, this is going to be kind of weird, but you can't even tell. Like,
Oh,
I stand up and it's like, well, it doesn't even, so thank you for that gift.
oh,
I don't even know if I ever told you that, but I don't remember it every time I look in the mirror.
oh.
And so that's a blessing.
Oh, well, thank you so much. I mean, that is really my goal. I always say this is the most, the hard enough as it is without adding in, a visible incision. That's how we used to do all of this. We used to just kind of go right over the top of the cancer, and it would just be this big, ugly incision. And then we wouldn't bother trying to put patients back together so they'd have a huge defect. And
Mm.
so there's just some small things you can do sometimes that make a huge difference because again, it's kind of this bigger picture, right? We want to think about this whole person, and we know that you're going to get cured and you're going to go on and you're going to live this wonderful life. But we also don't want you to suffer the consequences for the rest of the life of all of this treatment, right? So, how do we improve your quality? And I think the number one starting place is just being able to look in the mirror, exactly what you said. Look in the mirror and not have to say, I had breast cancer every
Yeah.
single day, right? You want to just be able to look at yourself in the mirror and say, oh, well, that's great. And then kind of scoot on with your day, right? So this is this whole very intentional part of medicine that we can be incredibly intentional about how we do things and how we personalize care so that a patient doesn't have to suffer the unnecessary
Right.
consequences. And it's hard enough. It's hard enough without all that. So
It
yeah,
is.
absolutely.
And Dr. O'Leary, you don't need to comment on this, but I will tell you that I I feel pretty confident that had I had a different surgeon, it would have been different because I don't know. And here's another story about Dr. O'Leary. I remember I was so terrified going into the surgery because that was just how I was. And I will never forget being wheeled down and my surgeon is holding my hand and rubbing my hand. And you did that until I fell asleep. And I had you comforting me. And so, in addition to being an excellent surgeon and doing an amazing job and getting it all, having, all the margins, you kept me in one piece. And I
Oh,
am so thankful. And I know not everybody can have that outcome, you know?
thank you. Thank you. You're making me tear up here too. I'm just well, I'm glad I could make a positive difference for you and your story. And I think it's just again, I think these small things make such a big difference to
Yeah.
patients. And it's huge though. It's big for them because it's so much stress and it's so much anxiety and it doesn't necessarily have to be that way. And especially from a provider standpoint, I mean, I've seen so many people go through this, so I know you're gonna be okay.
Yep.
But how do I convey that to you, or how do I give that to a patient who has just gotten those words, "You have breast cancer," right?
Right.
You start with that and pull them back from that ledge and have them realize it's gonna be okay. And I think that is the biggest gift you can give to a patient, if you can just spend that extra time and talk to them and hear them, listen
Yeah.
to because your story is just as important and it's part of the bigger picture. It is the whole picture,
Mhm.
right? So it's the most important part. So I'm so glad. Thank you so much for sharing that.
Oh
That's
my gosh, yes, and, I have to say one other thing that is amazing about you and my oncologist is you say cured. You're cured, like, go live you're cured, and that, like, hits you and I can believe that, like, I believe that, and it's true, and that's the thing, and we can kinda start talking a little bit more about breast cancer today and early detection because this podcast is about helping women feel better and live better. And this is what I want you to know. Breast cancer, I made it a lot harder by being so afraid. It kind of isn't really that scary. Like all the things that I went through, I thought were going to just be horrendous. And I had to go through the heart. I had to do the chemo thing. I tolerated that very well. I mean, I lost some hair on the top of my head, which was hard, but I cold capped and my oncologist was so positive. So, and this is, I mean, early detection is so key. That is why don't be afraid. Now I like going, go check every mole on my body. Go like just check everything because I know
yeah.
when you catch it early, it's amazing.
Mm.
You catch it and you're done with it and you move on. So I think early detection, and I remember in my case too, we were heading off to Arizona and I was like going to go get a heart test, like a calcium scan. And then I'm like, I'll just go get my mammogram because I was a little late in getting it, maybe a couple months. Praise God that I did.
Yeah. Yeah. It's a huge deal. I mean, I think there's so many reasons and so many barriers to patients for, going out and getting that annual mammogram. I think that it's a lot of things. We have 1 in 8 women that are diagnosed, and actually 80% of women have no family history of breast cancer. So
That was me.
case
Yep.
in point, case in point. So oftentimes patients are in my office saying, how in the world, why in the world is this happening to me? But we know so many things about, who is at risk for developing breast cancer and who needs to worry about it. Sorry, I'm getting all sorts of calls here at the
Oh,
same
well, you're a busy
time.
woman. We just
It's
appreciate you
okay.
being here.
No, no, it's okay, it's okay. But I apologized about getting distracted there for a
No
second.
worries.
Yeah, so, it's so important to go out and get that mammogram, and it's so a lot of patients feel they say, "Well, I don't have a family history, so I don't have to worry about it." Well, we just stated, that's not the case, right? A lot of women are just such amazing people and we take care of everybody else, and we always kind of forget about ourselves at the end of the day. And that, to be able to continue to take care of our children and our husbands and our loved ones, um, we need to take care of ourselves first, right? And so, and just like you're saying, if you find these things early, it's really a no. I mean, for most people, really a straightforward thing that we can cure, right? We can
Yeah.
take it out, we can remove it, we can move forward with your life. I think cancer, a lump on somebody's breast is very scary. I think sometimes that delays people coming in too, as they're nervous about what if this is the big C word, right? And what does that mean? I just feel like breast cancer in and of itself is so unique and so different from so many other types of cancer. Things are always changing for the better for breast cancer patients. Every aspect is all about trying to be more and more minimally invasive. And what do we absolutely need to
Right.
do to cure the patient? And there's so many new, drugs and new ideas on how to do this all the time. So that's one thing I always warn people once they've had a cancer diagnosis is I say, just because, people start to come out of the woodwork and tell them their stories, well
Yeah.
intentioned, but I'm like,
Yes.
it doesn't matter if you've got a, triple negative or an ER positive
Yeah.
or two positive. Each person's story is completely unique, and when they're getting treated is unique. So everything is changing all the time. So what we did even a year ago for some types of cancers may be something completely different now.
Right.
The really, really wonderful, fast-paced field, and it's all about trying to do this in a better way and to try to really eliminate these cancers. So, don't be afraid because of what you're seeing online or what your friends are saying. I think going out and getting that mammogram, to the point of the mammogram, if we say start at 40 years of age and do it every year. However, there are some women who are higher risk. So,
Okay. I wanted to talk about that, Dr. O'Leary, because I, interestingly enough, I have an accountant whose daughter had breast cancer and she did pass away, which was very sad. She fought it for 12 years or so, but she was 30. So
mm,
she wasn't getting her mammogram. And I'm like, daughters, go get your mammograms when you're 30. I feel like, why wouldn't everyone? Because we don't really know, but can you get that covered by insurance?
well, this is a great, I love that you brought this up because this is actually a really important point. Um, as of 2019, our American Society of Breast Surgeons really wants all women, which means millions of women at the age of 25 years of age, to go in and have something called high risk assessment. Okay.
Okay.
What that is it means sitting down with somebody like me, or you can Google away at any state that you live in and look for high risk clinics. They exist everywhere. And sit down with somebody and say, okay, they'll go through everything, all these risk factors. Things like, when did you start your first period? When did you go through menopause? When did you start having babies? Did you have babies? It goes on and on and on. There are many, many different estrogen exposures throughout our course of our lifetime, which can really influence this risk. But the idea is starting at around 25, because if
Okay.
we can have all 25-year-olds doing this, then we know, boy, this 25-year-old or this 30-year-old, let's say, we need to start doing imaging at 30, right? We can't
Yeah.
wait until 40. And that's essential, really, really important because we've actually had a rise in our incidence of breast cancer development in our younger population. So our 40 plus year old has just kind of increased, and just in the recent time, which has actually changed some of our guidelines and for the better, to
Yeah.
try to capture more of this. But you're absolutely right. Those patients who are in their 30s and their 20s who can have breast cancers and they're not even looking for it yet,
I know.
those are the ladies we really wanna be able to reach, and also, things like breast density, right? So you get a mammogram back and it says, "You have dense breasts," so it's not very sensitive for your breast type
Right.
and might miss something, right? And so people who have dense breast tissue, but who are also high risk for developing breast cancer determined by one of these risk scores, they are eligible to have a mammogram alternating with an MRI every year. And really,
Wow.
for breast density, there's nothing better than that breast MRI. So it's really so important to be asking these questions and saying, gosh, listening to this conversation, or boy, I have breast cancer. Should my daughter do this? Right. So it's all of
Right.
things. Right. So just being able to go and start at 25, knowing if you need to do breast exams every year or what you should be doing is so important.
This
You're having
really
the same
bizarre.
issue too as
Now
I
what's
was.
really bizarre is here's the old pro. I'm on Do Not Disturb. I'm
Oh, that's so funny.
so
Well, I don't feel so bad now that mine went.
the host. You know what it is? Darn it. It was a kid. I forgot to tell my daughter in Arizona at school that I was doing this because when you know how for those kids you let anything come through.
Yeah.
So sorry about that. But
No,
we're
it's
talking about kids
yes.
now. And as I'm talking to you, I'm sending my daughter is 30 and she's a medical doctor and she's in Edina now. She's coming to see you. And
Sounds
so is my daughter-in-law, who is 27. She's
perfect.
coming to see you. Her dad was just diagnosed with, but here's the thing. This is what gives me chills, is it's curable.
Mhm.
Early detection, it's so curable. You can just, you can get it, you can catch it.
Yeah.
So, I just that's what I want. I want everyone listening to make sure they get their mammogram, and I think me having breast cancer and kind of alerting friends that didn't get mammograms because they were like, "Oh, I don't really know if I wanna do that," started going, and so that's a huge blessing.
Mhm.
So yeah, if you're listening, get your mammogram, send your daughters in for early detection at 25. Start there because I bet a lot of them are going to be able to get a mammogram.
Yeah, and it's just again, you're so right. It's all about catching this early. And the other component of this is genetics, right? The question
Mhm.
about genetics, right? I mean, that's the whole nother part of the risk conversation that we have when we talk to patients to determine if they're high risk for developing breast cancer or not. Oftentimes, even though 80% of these ladies have no family history of breast cancer, oftentimes they have other cancers in their family. They have prostate cancer or ovarian cancer or skin cancer, even.
Right.
And they're just the first person to develop breast cancer in their family. And oftentimes, all of these mutations on one side of the family can be explained by one mutation, which is pretty amazing. And I think
Yeah.
that's what everybody wants to know is the why, right? Why
Mhm.
me? And do my kids have to worry about this? Does my sister have to worry about this? Does my brother have to worry about this, right?
Right.
So genetics is a moving target. I think that's also the other big message I'd love to get out there,
Right.
which is because I have patients who come in all the time and they say, I was tested and I'm negative. And I'm always say to them, well, you're negative for what we were testing for then, right? Because
Right.
it's a moving target. We're learning more and more and more about genetics all of the time. And it's just gonna change everything. I think it's gonna save so many lives. I see that all the time with patients who come in with a breast cancer and they find out they have a BRCA mutation that predisposes them to an ovarian cancer. So they
Mhm.
decide to get out their ovaries as a result when they're done childbearing and
Yeah.
everything. And oftentimes, not often, but it happens that we will find that the patient already has a really early stage ovarian cancer. So it's a really big deal. This is a something that ovarian cancer, unlike breast cancer, is not something that you can detect early. And so it's so you get vague symptoms of bloating and things like that.
Right.
It's just I just see this foresee genetics and our especially once it's out there and it's more on the family practice level and so everybody's getting a full genetic panel. Um, I think that's really going to save lives.
So when they come in for that high risk appointment, do they get that genetic testing done? Is that part? Yeah. And I think what you told me is it's only going to help when you do that genetic testing, you're helping the scientists more, aren't you? By giving them your
Yes. Yeah. So
yeah.
that's a really interesting point, actually. And that's a great point. These, depending on which company you're using, they all have different algorithms and
Yes.
how they share or don't share. They don't share your name or any of, they can't do that because HIPAA laws protect people from sharing your personal information. But when you do get genetically tested, though, that you're absolutely right. There's all sorts of these big databases. Sometimes they're within a huge company. Sometimes there's ClinVar. There's a bunch of these big online sources. So every time we're having a patient with a cancer plus a genetic mutation, a pathogenic genetic mutation, that's oftentimes being registered at these
Right.
big registries. So now, again, not the patient's name, because I know everybody's
Right.
nervous
Right.
about
Right.
that, but just the mutation with what type of cancer they're having. So you're absolutely right. This is a big collaboration. And the more we're doing this, the more genes we're looking at, the more we get to that answer of why. Why me? What's going on? Who needs to be worried about this? Should I be worried about another cancer? Right? All
Right.
that stuff. Because it leads to that, again, that early detection, right? If you knew you were at risk for something, then you would just go ahead and you go get screened or
Exactly. Exactly. Okay, that's so helpful, and I'm trying to be very, cognizant of the time because it's almost up. But I think, and everyone who's listening knows I have my little saddle up segment on Thursday, and I'll try to, uh, put in anything that we've missed. But everyone wants to know, how can I keep this from happening? And I know I feel like I live my life trying to be metabolically fit, and I have learned some things, that I maybe wasn't doing right. And I think one big thing was stress. And Dr. O'Leary, I think trying to follow the rules of health and white knuckling it through fasting and everything in my life
Mm,
probably was a big reason why
mm,
I developed it.
mm.
And I don't really have alcohol anymore. I said, "Oh, I just have a glass of wine." That was so back in the day, not so much now. It was so, "Have a glass of wine at night, it's good for you." Yeah, I don't know if it really is.
No, I don't think so, at least not from the breast cancer perspective.
Right.
No, it's a great question. Stress, 100% believe that stress contributes to the depression of our immune system and our inability to fight infections and then also cancers, right? And it's not uncommon that it'll have somebody in there and they've just gone through a big divorce, they've had a death in their family, their have job has just been horrible, they have a bad boss, etc., where they're up all night and they're just not sleeping. And then they've now found this breast cancer on top of it all. So
Mhm.
I just can't imagine what type of stress is in their system and what's, that suppression of their immune system and their system ability to work as well as it should be able to.
Right.
The difficulty with stress is how do we quantify stress? We can't, right? Really, we can't say, we can definitely look at somebody from a subjective say, gosh, this poor person has gone through so much, right? But it's really difficult to study because of that. So it's hard to study how, we know these things make sense, but how do we really look at this in a person's life and how, but I think there are some ways, just you mentioned a few of them in terms of decreasing your risk of developing breast cancer. I always say you can Google and find 1,000 ways to decrease your risk for breast cancer, but I tend not to believe them unless we've really had
Yeah.
excellent studies that have kind of shown the same results over and over again. And the first and the second are, of course, diet and exercise. Those things are so key. I wish I could tell you that there was a perfect diet. Nutritional studies are really, really challenging to do and to do well. So it takes, enormous population level data and just a lot of resources to do them well. So we have a lot of contradictory data that's out there. I think the main message is just to maintain a healthy weight for you.
Mhm.
And I think everybody has a kind of an idea of what that is. Everybody's
Mhm.
different. They have different bone structures and muscle mass and all sorts of stuff. So we can't just give you a weight. That's not going to work for everybody, but everybody has a good idea. So just maintaining a healthy weight. Now, there's obviously a lot of different ways to do that in terms
Yeah.
of how you're eating and what you're eating. We were focused very heavily on low fat diets for a really long time in the breast world, but there's been a lot of pushback about that lately, kind of saying, well, is it really the low fat or did they just, lose weight or what
Right.
exactly is it? Is it really, was that really it? Processed sugars in our diet has been another big question, and I won't be surprised as the data matures if that doesn't play a bigger and bigger role in cancer development. But we don't have, again, we don't have these really great, huge cohort studies where we're intentionally really trying to answer this question. I mean, it would probably take a sample size of something like 130,000 to really answer that question. So it's a big
Right.
deal. And then the other thing is exercise, right? So exercise, we recommend somewhere between 150 to 300 minutes a week. I really try to push towards the 300 minutes a week of exercise. It includes both aerobics as well as weight resistance training. And there's, again, if you're labeled high risk or you're a breast cancer survivor, there's actually programs out there that help you to achieve that. And some of it doesn't have to be intentional. Some of it's just like,
Right.
you're walking up the stairs instead of taking the elevator, right? Or you're just
Exactly.
doing something that might help you. You're going to do it anyway, but you're just going to do it, or you're walking a little faster to get that heart rate up,
Right.
right? So the diet and exercise super important. Alcohol is definitely number 3 on my list.
Oh, good.
It's an interesting one. You know, it is so well studied in relationship to breast cancer, and there's a lot of hypotheses as to why that is. Because we can definitely see after a drink of alcohol that a person's estrogen level increases, right? So that's an objective measurement.
Mhm.
Um, so the question is why, right? And I think there's been a lot of hypotheses out there that potentially, your liver is just trying to clear that alcohol out of your system. It's a
Mhm.
toxin to your system. And so it's not doing some of the other stuff as well as it should, like clearing estrogens from your system. So that over time, of course, you get that big boost of estrogen. So you can imagine after 2 drinks of alcohol,
Right.
3 drinks of alcohol, how much that estrogen level is just sitting up there. So it's a really important correlation. And I do know that the previous Surgeon General was actually interested in putting breast cancer on the outside of alcohol bottles, just like we have lung cancer on the outside
I
of
have
sweat
so
packs.
Dr. O'Leary, do you know I was not aware of that. I wish I had been. And so let's get that word out there because
Yeah, let's get it
isn't
going.
that important? That's so but it and that was just something that I kind of concluded on my own because I'm like, I exercise, I eat really well, but I had the stress, and I then to try to get out of the stress, I'd have that glass of wine at night. And think about that just over and over every night. Could not have been good for me for years and years and years. And for now that's out of my life.
Mhm,
And I'm just another thing that I'm learning is just to joy, like to have fun with like this right now here. This isn't work to me. This is so joyful to
mhm,
have fun and enjoy your life. And that's gonna kind of reduce your stress a little bit too. And I think I was missing that. Like, how do you have fun?
mhm.
We women, we can forget about that, can't we sometimes?
Yes, yes, indeed. Yep, absolutely. No, I think that's such an important point. I always try to emphasize to patients, especially as they're going through everything, stop, pause, go do something fun. Go
Yeah.
on that vacation you've been wanting to go
You
on.
did tell me that. You
Yes.
did tell me that. You said before, and I didn't because I was just like, I just got to get this done. They just
Yeah.
hustled me right through everything.
Mhm,
But it was amazing. And Dr. O'Leary, from the bottom of my heart, I am so thankful for you, for my journey, for my story, for that friend of mine that you helped through her journey and through my children, my daughters, my daughter-in-law, who you're going to be helping in the future. So I'm just so thankful for you. And I'm thankful that you took this time because I don't know a lot of other, highfalutin surgeons who would sit down with little old me and talk about this. So my heart, I just appreciate you so much. And I recommend you. I mean, if anybody wants to send their daughter, wants to go check and see if they're high risk, wants to just check things out or is scared about something, go to Dr. Elizabeth O'Leary. We're going to have your information in our show notes, but I think it's just, is it just Dr. Elizabeth O'Leary?
Yep. If you go to, the website, I believe it's, the
Yeah.
www.elizabetho'learymd.com, and then you'll find, Lady Slipper, you'll find everything
Yeah.
there about us. But, we have 3 locations at this point. We're in St. Paul, St. Louis Park, and Edina, and so please
Yeah.
come on over. You're welcome. And it's again, it's been my honor today. I really have enjoyed talking with you and educating your public. And thank you so much. I really appreciate the opportunity.
Thank you so much, honey. You take good care.
Okay. Take care.